In vitro fertilization, IVF, is one of the best-known assisted reproductive technologies that will help couples experiencing infertility problems. IVF can simply be explained as the process of fertilizing an egg and sperm together in a laboratory petri dish. However, the procedure itself can be painstaking and must be done in a perfect timing in order to be successful. The first step. It is necessary to retrieve several eggs for IVF treatment. Therefore, women will be given hormonal medications, like clomiphene, human minoxidil gonadotropins, HMG, or follicle-stimulating hormone, FSH, for about 10 days. These drugs will help to promote the development of several follicles and therefore several oocytes. Also, it is easier to determine when ovulation will occur with these drugs administered. However, frequent monitoring is still required. Regular blood tests are done to measure the levels of hormones. Step 2. Timing is everything in this process. An egg retrieval that is performed too soon may result in immature eggs that can't be fertilized, while waiting too long may cause the eggs to be too mature or possibly even be spontaneously released by the woman's body. To harvest the eggs, the physician will administer a partial anesthetic dose that will help the female to feel more comfortable. Then, locating the mature follicles with the help of ultrasound, a long, thin needle will be passed through the vaginal wall to the ovaries. The needle will then suck the fluid from the mature follicle. An immediate microscopic observation of the fluid will reveal whether or not an egg was retrieved. If an egg was retrieved, it will be removed from the fluid and placed into an incubator. The process will then be repeated to retrieve several more eggs. Once the eggs have been harvested, progesterone supplements will be given to the female or surrogate mother to help make her uterine lining ideal for implantation. Fertilization. Shortly after the eggs are harvested, a semen sample is needed. Then, the sperm is processed before being placed in a petri dish with the harvested egg. Using an incubator that is set to stimulate the same temperature as a woman's body, the egg and sperm are left to mix together for 14 to 18 hours. After the incubation period, examination under a microscope will reveal which, if any, of the eggs have been fertilized. These will then be transferred to another location where they will be left to naturally advance. An embryologist will oversee the fertilization progress to assess whether or not development is taking place normally. Once they have reached the 4 to 10 cell stage of development, pre-implantation genetic diagnosis may be done to further analyze the health of the embryo if requested. Transferring. Once the embryos are ready for transferring, between 2 and 5 days after fertilization, a long tube is used to gently release the embryos into the uterus. This is a relatively painless procedure that doesn't require any anesthesia. An ultrasound may be used to help guide the placement of the fertilized eggs into the uterus. If all goes well, then at least one egg will implant into the uterine lining. The total number of embryos transferred back into a woman's womb can vary. Some clinics allow the couple to decide how many embryos they would like to transfer, while others may have a standard preset number. In some cases, a couple may decide that they would like to freeze some of their embryos for future use. Factors like a woman's age, the cause of infertility in the couple, as well as the woman's past history of pregnancy can all influence the decision of how many embryos to be transferred. Blastocyst transfer. Advancements in reproductive technologies have resulted in the development, allowing embryos to grow in the lab to the blastocyst stage. While IVF treatments are used to transfer embryos to the woman's uterus at day 2 or 3 in development, nowadays technicians can wait about 5 days, when the embryo has developed into a blastocyst, before doing a transfer. This delay means that only the strongest embryos are transferred back to the woman. As a result, there is a better chance of pregnancy occurring and therefore fewer embryos needed to be transferred. Success. About 2 weeks after the transfer of the embryo, the woman will return to the doctor's office for a pregnancy blood test to see if the procedure was successful. The chances of success vary according to the woman's age. A young woman less than 30-year-old may have as much as a 50% chance or greater of becoming pregnant, while a woman older than 40 only has about a 10% chance or less. Moreover, women undergoing IVF have a greater risk of experiencing an ectopic pregnancy. Odds and ends. IVF is often recommended as a suitable treatment for women with unexplained infertility, endometriosis, blockage or tubal damage, or ovulation problems. Men with low sperm count may also find this technique helpful to get their partner pregnant. However, this technology is not cheap. One cycle of IVF can cost anywhere between $8,600 to $12,000, and possibly even more. While some couples have been successful at getting pregnant after only one cycle of IVF, others have tried 3 or 4 times with no success. So, before deciding to take advantage of IVF, it is important to discuss how much is needed to spend on the procedure. Also, discuss what alternatives will be available in case this method is not suitable. Other benefits of IVF. In vitro fertilization can also be utilized in scientific research. IVF can be used to help make knockouts, make embryonic stem cells, study developmental biology, and many more.